This video is quad massage, and as part of quad massage I'm going to be showing you the groin or the adductors, and also talking about IT band or the abductors and the TFL at the top. So we'll uncover the client up to here and expose one leg, make sure they're nice and warm. And what I normally do is I ask my client if they don't mind tucking up so I can get a bit higher, because at the moment we've got about half a quad out here. So client, if you don't mind, right up to the top there, so that they will expose what they want worked on. And for massage on the quads, the higher up we can get, the better. I'm going to be using Naki Sports Massage Lotion today. Warm it up first, and just spread the lotion. So even though I've called it a quad massage, really it's anterior thigh. I'm going to be getting all the muscles around this area. And I'd also suggest, if you're a student on a course and wanting to learn about the anatomy, I've got a really good video on muscles, and I'll be drawing on my subject with pens so we can see the insertion origin, bellies, and also the movement as well. So have a look at that one for more specifics on muscles and also bony anatomy as well. So all I'm doing there is spreading the lotion, doing some effleurage just to warm up. Couch, I've dropped a little bit in height so I can use straight arms and apply body weight over the top. So I can call the first technique longitudinal effleurage, where I'm working up to the outside of the hip here to where TFL is. We don't want to be working this way to the inside of the leg. So all my techniques will end at the top outside part of the thigh. And to make it a little bit deeper, we can go one hand on the other. So this one is reinforced effleurage. Don't want any pressure over the kneecap itself. So just start above that. We're going up as high as we can. Now there are 4 quad muscles. Only one of them crosses the hip joint. So I won't be able to get to that insertion or the origin, which will be right at the top here, but I'm going up as high as I can. The other 3 quad muscles are the vastus muscles, and they will all connect here just at the top of the femur. From here I can move to a technique that I call crisscross lifting. It's a petrissage technique. We're lifting up. If you've had a look at the hamstring video I've done, all the techniques are really similar, but with the quads, because there's a lot more going on in terms of muscles and direction of fibers, you will find at points in the quad where it feels like you clunk over or click over certain muscle groups. So we'll see how we go, and if that happens I'll point it out, but it is something to be aware of. The quads, you will find a lot more of that than the hamstrings. Hamstrings just go straight from the knee up to the thigh. So we've got sartorius, for example, crossing over here. Then we can move to a kneading technique. It's really nice to get near the knee here and just work around the top. I'm not going over the patella, but just where the quads attach through into the patella tendon across here. And again, I'm also doing some work. You can see my fingers here are on the adductor muscle groups. I've got some specific techniques for those later, but at that point I will have warmed it up. So my fingers are there working on the adductors. My thumbs are more on the outside working on the vastus lateralis. There's some IT band in there, and working up to TFL. So we're getting the whole anterior thigh. Just going to get a little bit more lotion. So we've done some kneading. So getting a little bit deeper, I'm going to get my forearm in. So forearm effleurage is really good. Takes the pressure off your hands. We're going to lean on. Lean your body weight through. Go up as high as you can here. Change the angle that you're working. You can change the arm that you're working. So if I want to go more outer, go to this arm. And as we go up to the top here, We've got the tensor fasciae lata, the TFL. Okay, so this will feel a bit deeper. So again, when the client's supine, we can have a look at facial expressions. We can check the feedback levels. Make sure you're doing that constantly, especially if you're just starting off. As you get more experience, you tend to ask less, but you get to understand the body and reactions a bit better. So we can see some erythema coming already now. So everything's warming up a little bit. Try and just go from one technique to the other. So I'll be telling you the names of the techniques, but then while I'm talking, I just go back to some kneading and some effleurage. Never stop, keep those hands working. Okay, we can go a little bit deeper again with the fist. So we've got effleurage du poing. So we can go one hand going up this way. And right at the top, you better see the trails of the knuckles there. And because the quads on my client here, my client's a sprinter, so he's got some great quads here. In fact, just for the video, let's have a look. So come in, sense up for me. There we go. So we can see a vastus medialis, lateralis, quick before he cramps, and a rectus femoris in the middle there. So great definition and relax. And we want to be getting all of those muscles. And the more relaxed the client is, the more pressure they'll be able to take. So back to our effleurage du poing. We can go two hands. Okay, you can go two hands or one hand. Now moving on from that is a technique I use in most body parts, and it's called lengthening. So lengthening is a combination of using effleurage du poing and also movement from the client. So we need to think. We want the quads to be in a shortened position, and then while they're lengthening, I'm going to be working. So for this, the best way to do it, I'm going to move the client's leg over slightly and just ask them to drop this leg off the couch. Okay, in this position, with the knee flexed, they're actually on a bit of a stretch. So if we straighten the leg, that shortens the muscle. You can see he's contracting here, but that's fine. And with gravity, when I start here, my client is just going to let their foot go down slowly. That's good, nice and slow. And at the time that foot gets down to about 90 degrees, I'm at the top of the thigh and we'll extend. So I'm putting some pressure on here. Straight arm if you can. That's good, good control. And extend. I might even use a forearm here. So you can go through different techniques. Again, looking at facial expressions from your client just to check your pressure. That's good. And we'll do one more. That's good. So it's a combination of massage technique and client movement. Okay, and a bit of effleurage while they're in this position. And that erythema is looking really good. It's really nice and nice and relaxed. Okay, let's bring the leg back up. Good. All right, that feels really good. If you found any particular tight areas, and I would say rectus femoris sometimes feels a bit tighter than the rest, or lateralis. Medialis is often weaker in clients, not in my client today, but in a lot of clients. So if you find a particular tight area, let's say there, we can go in and go with a bit of elbow stripping. So support, elbow in, pressure down, and then slowly slide your elbow upwards, nice and controlled. Okay, come back. So it's very specific. So this would be a bit stripping on the rectus femoris. Okay, soothe off. Okay, that feels really good. Let's just compare the legs actually, because for me, just come in nice and close. Let's have a look at that. Have a look at the wobble, which shows nice relaxed muscle. Okay, it's nice and red and relaxed. Just have a look at the leg I haven't worked on. Here. Okay, and you can see, yeah, there's not quite so much on that side. Okay, and this side is nice and warm and relaxed. So this technique we need to be doing on both sides. But while I'm here, we're going to be doing some work on the groin or the adductors. It's not really part of a standard massage I would do for leg massage, but if a client tells me that maybe a week or 2 weeks ago that they slipped in some ice, or they were playing football and they went out too much out to the side and they felt something on the adductors or the groin, I'll show you a couple of techniques you can use for that. So I've already warmed it up, but this is the first one you could use. So we're going to bend the knee up here. I'm going to put my knee on the couch and we're going to let the client drop outwards, sideways. Okay. Again, for discretion, make sure they are covered up properly and that they're happy with this position. But I would say now they're nice and relaxed. Okay, and relax here. If they had a bit of a groin strain or an adductor strain, they might actually be protecting the movement. So you might see this muscle. Let's just have a look if my client contracts this muscle here. Okay, try and lift your leg up for me. You might see some tension. Nice and relaxing. Relax, relax, relax. Okay, it should look nice and soft like that, which means the muscles relax. So now we can use all the techniques that we normally use, but we can get quite high up on the groin. If the legs were flat on the couch, you'd find this position going a bit too high. And I know on some courses, especially body massage courses, they say to avoid the femoral triangle, which is this private area of the body. But with this position, you can get right up to the top of the adductors that we need to get to. So have a look at the videos on where the adductors are that I'll be doing the anatomy videos. We've got 3 main ones, so we're working on magnus all the way up the length. Longest starts halfway here, and then we've got a brevis right at the top. So we can go stripping. We can use open knuckles. You can apply frictions if there's any particular adhesions on it. And it's just a nice position to work in. However, I'm going to get the client into a different position that I think is even more effective than this one. So I'm going to put the client back down here and turn them over onto their side. So I've rolled my client over now and I'm working on the same leg. So we're still working on the groin, but I find this position, I call it a recovery position. So this leg I've covered up, we've tucked up quite high here. And now I can actually work on the adductors with a straight arm and I'm pressing down through the muscle and the couch is underneath. So with the other position, I find because it was on my knee, you could get less pressure, or the client might not relax as much. With this one, I find it a lot easier. So depending on how much work you want to do on the groin or the adductor muscles, have a little play with the different positions and see what your favourite is. So we can do effleurage du poids, we can do forearm, go right up to the top there, because the adductors attach onto the pubic bone, so they attach right up onto the hip. You can go stripping, and any other technique really, open knuckles like so, thumb stripping. But this is an add-on really to the quad massage if they have particular issue in this area. So soothe off, and then from here I would take them back into a supine position, face up, and carry on working on the quad. As part of our anterior thigh massage, you can include the lateral part here. So with the lateral part of the thigh, we're talking about the vastus lateralis muscle. And if you come around, you can actually see, we'll get my client to tense up again, just to have a look. So we've got the lateralis, and then this band here, look at that. You can see that, it's great definition, all the way up to the top where we've got the TFL. Just relax for me. So any work I do up the lateral thigh, I will be working on the vastus lateralis, which is important. Some people are obsessed with IT band massage. So working on this really tight band. And if we can just have a look at this diagram here. So we're going TFL. The IT band goes all the way down the outside of the leg to just below the knee. But all it is a tight band of tissue. There's no way you can actually stretch the IT band. So being obsessed with massaging that area, but what I would say is any work we do on this area, we're getting the vastus lateralis, which is a muscle that can be lengthened. So we can do ham and spindle, pressure into the side of the leg. So I'm pushing my body weight in and going up to the top, pushing in. My top hand is just guiding. This hand is the one that's putting the pressure on. So we're working up, and you can see I'm working a bit over the band, but I'm also working on that lateral thigh muscle, the vastus lateralis. Vastus actually means large or big, and lateralis on the outside. So it's the big muscle on the outside. Now, for example, if you have a client coming in, runners in particular, that ask for you to massage their IT band, well, you can use these techniques. In your head, you're thinking, am I actually going to be lengthening the IT band? Well, no, we're not, but then placebo is also really effective. So if they want a little bit more work on that iliotibial band, I'll show you a nice position to get them into. So we'll take this out. We'll get you rolling over. So that leg is up, face that way for me. Into a recovery position, roll over. That's lovely. Good. Okay, perfect. I'm going to expose the leg I've just been working on up to the top here, up to the hip. Okay, and then I'm just going to walk around the couch, but we can see bicep femoris tendon there. So that's part of the hamstring. You can see the IT band. Don't know if you can see that flicking there, all the way up here to the hip. So I'm going to come around now. So with the IT band exposed in this position, my client's nice and stable. This is a great position to give your runner the IT band massage they desire, if that's what they do want in a treatment. So I can use one hand to support and the other arm to massage this way. So I can go with my forearm. Okay, the slower you go, the deeper you could work potentially. If I did that as a quick up the leg, they'd be jumping off the couch. So nice and slow. But again, I am doing a bit of vastus lateralis in there as well. And if we go even further around to here, we're on the hamstring muscle, the bicep femoris. At the top of the leg, we've got this bony landmark, the greater trochanter. So we're not going to go any further than that. So we can use effleurage du poing, or we can go with our forearm this way. Saying that, I wouldn't really use this technique much myself, but I do want to show you techniques you can use for different client groups. I would do it more from the front and combine it with the quad massage. The most important thing you can do for IT band would be to work on the glutes and the TFL, which is in another video you can have a look at. So after the IT band, I've got my client back now into a supine position, and having worked quite deeply on the vastus muscles and rectus femoris, I've done some specific work on the adductors, the groin area. I've done a little bit on the IT band or lateral thigh. I'm just going to effleurage the whole group together, going back to my first few techniques. So my longitudinal effleurage and my reinforced effleurage. I can do a little bit of kneading and finish off in that position there. I'm going to cover them back up, and it's quite nice to just to press through. It takes a bit of the lotion off, and it shows your client that that's the end of that body part.